Good morning, Mayor and Council. This is Chief Heppel again from the Emergency Operations Center located at 2nd and Chambers with your COVID-19 weekly update. Today is June 18th. Typically, I give this update to you on Wednesdays, but we knew some information was going to be coming out from the governor with respect to the increased number of cases we've seen across the state, which drove her to make the decision to put some things on pause last week for about 7 days. So we'll talk about that here in a little bit, and that's why a little bit of a delay. So with that, we still continue with what I refer to as our onesie twosies in cases, and that we're getting, one case here, 3 cases here, no cases for today, etc., which is a good place for us, continues to be a great place for us to be as we move forward with phase 2 here in Lane County. We've got about 90 cases that are total cumulative cases we've seen in Lane County. 7 of them are still active, with 83 folks as inactive. 7 of them are resting at home, 80 recovered, and certainly are 3 unfortunate deaths. And you'll also notice that we don't have any in the hospital. So we've got another period of time here without anybody being so sick that they needed hospitalization at one of our local hospitals. So that continues to be a good piece. And if we look at our epi curve for the county, we're still staying pretty flat with a couple of isolated incidents. But remember, we're still just that onesie twosie if we take a look at that y-axis in our chart. Testing in Lane County continues to go up. I believe we're just at about 14,000 total tests as of last week. You see this week we're actually pushing 17,000. So we're definitely seeing that increase in our testing that is attributed to certainly Lane County going out and doing some of their surveillance testing. I believe last week they actually had they continue to target our vulnerable population, one of which is our Latinx community. And they actually had a testing opportunity for that community down in Cresswell. Speaking of the Latinx community, they continue to be a large portion of our total cases. 33 of our total cases here in Lane County are from that population. Last week it was about 34%, and this week we see that it's almost 37%. So again, I think a lot of that is at our targeted testing. We're starting to continue with that surveillance piece moving forward. So here's just another graph just showing how we continue to rise in our total tests, and we're doing good from that perspective. You might hear the governor talk about the scorecards, or she references the scorecard. So this is the data that we send up to the state on a daily basis, they being Lane County Public Health. That data is then usually pulled on Wednesdays, and then it's evaluated, and then the Oregon Health Authority, in conjunction with the governor's office, determines whether a county may move forward in a phase. We say stay in the phase we're in, or potentially could end up being regressive in that particular case. So this comes right off of the governor's website in Oregon Health Authority, and across the top right here are those criteria which we need to continue to meet to stay in phase 2, which I believe we're going on 3 weeks now, so we're doing well. That first category is our percent of ED being emergency department visits with COVID-like illness. We need to be below 1.5%. We're doing well in that particular case. We're at 0.6% right now. Our trend and the percent of tests are positive. So this trend should not be going up, right? So if we're doing more testing, we know we're going to see some increase in positives, but we shouldn't have this massive vertical climb on our chart, and we're not seeing a trend there, so that's a good place. The next column, or the third column from the left, is the percent of increase in new cases in the last 7 days. We're actually down considering the week prior. So again, that's a good place for us to be, and we're down, and we still did well over 2,000 tests in the last week here in the county. Percent of our cases not traced to a known source in the last 7 days. So that should be less than 30%, because actually our goal in the big picture is we want to connect those cases right back to an epidemiological component or piece or reason, and say, yep, we are able to track it. This is how the virus is transmitted, and then with those folks who would isolate and quarantine as appropriate. The other piece is the trend in hospitalizations. As I said, we got nobody in the hospital, so we're doing well, and that's a dot because we really don't have any data because there's nothing there to present. And then our last column is the percentage of cases in the last 7 days, we should be following up within 24 hours. And we're doing well on that. So what that means is all the positive cases that we've had, we've been able to, we being Lane County Public Health, has been able to follow up with those cases within 24 hours. What that means is that we have sufficient contact tracing in place. So if we look at counties that may not be in a good place, we've talked last week a little bit about Lincoln County and the outbreak they had in the Pacific Seafood Facility, and that's the line right below Lane County. And you can see the difference there where they, in the second column, they showed that uptrend. In the third column, they had a 1,914% increase, and that's because they had that tremendous spike at that particular facility, and they didn't necessarily have enough contact, if we go to the last column, enough contact resources in place to do those follow-ups within the 24 hours. I know that resources have been sent to Lincoln County to help out with that particular case, and they're getting into a better place in isolating and quarantine as they need. But that's just an example of what the governor's scorecard looks like on a daily basis. Take it up to the 10,000 foot level, looking at the state as a whole. We've got these large spikes that we've got right here. And if you've been watching some of the news, we've been seeing this fall out in some of the counties. I believe it was Union County, for example, that had the case where there was a private gathering. Folks were quite a few people. They weren't using social spacing or masks appropriately, PPE, hand washing techniques, et cetera, and it really spread out in that community. And in the last week, they've reported over 240 cases. So that's a tremendous spike there. They had another case or outbreak in a food processing facility in Multnomah County. They're at 20 cases right now, which drove that up a little bit. As well. And that's what we're starting to see across the state, is where we're seeing the spikes is predominantly in our agricultural community as folks come into our area to harvest the appropriate food products for the years, and then the subsequent processing of food products, so at food manufacturing or processing type facilities is where we're seeing some of those spikes as well. So the good news is we're able to isolate those folks and get the appropriate resources in place. But that's what's causing many of these spikes and processes that we're seeing in the state right now. The good news is Lane County continues to be in a really good place as we move forward, and we're going to stay in phase 2 for now. Another question that's come up recently is about our long-term care facilities, specifically our nursing facilities, et cetera. And what they're looking at here is a 2-phased approach in terms of testing in those facilities. They'll start this month and go through September, in which all staff will be tested, and then all of those patients who wish to be tested will be offered testing as well. And that'll be done again between now and September. And then my understanding is those folks who do not want to be tested, they can be moved to a different portion of the facility, maybe an area that they would be quarantined because they're not necessarily showing symptoms. They'd be there for 14 days, receive their normal services. If they don't present with any symptoms, then we could assume that they're no longer, they're not symptomatic, or they don't have the COVID. So after the September and phase 1 process, they would move forward with active monitoring, and that would look at that in terms of monitoring of staff, as well as residents, as well as visitations, et cetera, to continue to monitor the COVID and have early identification if you had a particular outbreak in one of these long-term care type facilities. So the governor and her staff through Oregon Health Authority did release a 2-phase plan on that topic. Our EOC continues to demobilize, and I've been shaking a lot of hands, and thank you so many people over this last week who have helped us out. So staffing is on target to move to be at the end of the month, and we'll end up probably moving our EOC out of our Second Chambers facility to a smaller facility or smaller location, so we can start getting some things back to work here at headquarters. Our designated temporary shelter sites, we started movement yesterday of folks to the new microsites, which have been established. This particular photo is one of our microsites at Skinner Ranch. And we're working on finishing up. We have just a handful of folks left to move, and hopefully we'll get that done here in the next day or two. We continue to to rearrange our restrooms and hand washing stations, those again that aren't being utilized very often, we're sending back to the vendor. And then we've had some that do have some utilization, particularly in the downtown area, that we're leaving in place for now. And we'll leave them there as long as we can. Personal protective equipment, again, continues to be managed and monitored by Fire Logistics here at 2nd and Chambers. Continue to stay safe. This is our new reality for quite some time. Just keep folks home. If you're sick, stay home. If you've got, you got folks who are at risk for severe complications and underlying medical conditions, keep them protected. Good hygiene, cover those cover those sneezes, etc. Practice that social distancing, and certainly utilization of face masks is a big piece. So that message is not going to change for quite some time. We're just kind of settle into our new normal from that perspective. With that, face masks. So the governor, because of some of the spikes that we've seen in some of the counties, the governor announced yesterday there'll be some mandated for folks. Those counties are, so the way it came out, to be very clear here, she instituted a requirement for wearing face coverings while they're in indoor public spaces, such as grocery stores and other businesses for the counties of Multnomah, Washington, Clackamas, Hood River, Marion, Polk, and Lincoln County. And this mandate is going to be effective next week, starting Wednesday, June 24th. And why I bring that up, again, it's not affected, but Lincoln County is not affected, but folks are starting to travel more often, and we need to be cognizant and aware of the restrictions that are being implemented within other counties in our travel, so we can be just supportive of that. So just some heads up again, though, we do not have a mandate in Lane County. We continue to encourage folks that if you're unable to maintain your 6 foot of social distancing, to wear some type of a mask. The governor continued to talk a little bit about yesterday about how we need to continue to watch our hospitalizations. So we still haven't seen a huge spike, but they have started to go up with these number of cases that we've had in the state. And if the capacity of our healthcare system is threatened, we will be forced to revert back to stricter rules. And so, that continues to go back to my statement where I've said pretty consistently all along, as we move forward positively, the virus, we're good until we're not. The virus is going to take its own path. And if folks start to become very lax in the protective measures that we're encouraging and we have in place, and lack of utilization, we could be going back or more restrictive or regressive within our own area. But at this point,